how to talk to each type of therapist, psychologist, psychiatrist, etc., doctor, surgeon, nurse. I'm going to go over this. I've been in a hospital dealing with these people for 20 years. What do I know about it, eh? Psychiatrists. Do not get mad at them. If they challenge you and say that something's wrong with that type of thinking, don't defend yourself against that. Say, oh, just don't even try to explain the situation, because when you start trying to they're going to twist and turn your words and make you look insane, because you're trying to defend what they are seeing is psychotic or something, right? And if you get a diagnosis with schizophrenia or like bipolar, yeah, that's how they diagnose you, but according to how you're in the meeting, right? And what the nurses are trained, also have to have, like psychiatric nurses, right? Not ER nurses, right? Have backgrounds of philosophy and psychology, all that too, right? You have to get undergrads in it, right? If they want to work in as a psychiatric nurse, they're all psychologists, right? So if you express behavior is completely, this is what I do. I don't give a fuck. I express right? And then to my doctor, I talk about drugs. I'm brain dead from the drugs, so if someone so much as mentions the word, I'm talking about the 60 a hooch in the shot, right? Yeah, well, whatever. They've heard it today, actually, at Courtyard. So, someone mentioned it, and then I went off, right? Yeah. So to the psychiatrist, how you want to talk to them is calm. You want to remain calm no matter what they say to you, right? You don't want to overly exert your symptoms to the doctor at all. The nurses can see it more, and they should, right? Because they are the ones monitoring and saying if the doctor is seeing this correctly or not. How do we talk to nurses? They have rules. Each nurse makes their own rules based on the ward rules. Learn what the ward rules are, and then see how each nurse applies them differently. For instance, let's make it Bob. Bob is a male nurse, and his rule is, I'm going to be the really strict guy. Strict. Every rule, do not come to the care station between 6:30 and 7:30 is my rule. If you come there, I will chart bad on you. Horrible. All day, the whole day you were good. You came to the nurse's station between 6:30 and 7:30. He's going to let you silently know if he yells at you once. Don't go to him at that time. You'll learn. You'll learn this as it goes, like as long as I've been here, right? Don't go to him at 6:30 or between 6:30 and 7:30 at the care station if there's a rule. But some nurses, some people will say, oh, I do everything, I break every rule, right? Well, what's their charting like? I had to do this and 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 this. Oh, he went out before his nurse told him to, could he? Yeah. I had to take him out because he asked me and his nurse told him they had to wait. Well, when his nurse comes back, she's not charting on that patient. And it's kind of planned because they know that, yeah, it's called splitting. That's what they call splitting. They don't call splitting like freaking out here. They call it going to a different nurse, right? So his nurse is saying, well, he split to this nurse who's obviously going to take him because she's very nice to all the patients, right? Yeah, it's like that. So which nurse breaks what rules? You don't want to go and break the rules because they're going to chart that they had to break the rule for you. Recreation therapist, occupational therapist, vocational therapist. Don't talk to the vocational therapist about what you want to do recreationally. Don't talk to the OT, occupational therapist, about what you want to do for school. Don't talk to the recreational therapist about what you want to do for work and school and cooking and all that, right? And you know, life skills, right? Life skills is occupational therapist. If you think you see that sign come up on the board, see there's a group. Now, there's completion certificates and there's pass certificates. You do not want a completion certificate if you have a brain, all right? They're monitoring everything you say to them in those groups. Those groups, happiness group, substance abuse group, what do you do in that group? Do you come high? Well, at the end of group, did he change and say you're going to go clean for a year? Because they're going to say, if you all go clean for a year, if you're in substance abuse group, that means they know you have a drug addiction. And if you do well, if you complete that, that's how you can get out with 1 year clean using, right? But you have to be so good when you're out in the community when they're monitoring you, right? They can't see any problems if that works, right? Yeah. So, psychologist, don't show up to the, so it said in my report, she appeared cleanly. She knew I had something shoved in my rectum, right? That was contraband. Yeah. But I was out of the shower and I passed, right? But I didn't pass. If they let the students do it, they're gonna fail because the students have no idea what they're doing, right? If the student is doing your psychological report, the bubble chart monitoring, they are gonna fail you. If you let a student, well, you have to sometimes. Like if you're in a forensic, you have to. Well, they go everywhere, right? Forensic psychologists. Okay, DBT, CBT, how's it going? Are any of the skills working? No, they're all not allowed, right? Say, well, I can use this from here, this from here. There's 3 skills you can use from each of those modules that are allowed here. Interpersonal effectiveness, you can be interpersonally effective, right? Emotion regulation, you can shut the fuck up. Can you? No, right? You can't. Like, one thing, maybe at a peak, just to not make it so bad, right? Well, you can debrief with them, right? And say, well, maybe next time I can do this instead. And if next time you actually do, well, then you pass, right? But how many next times are there for something different? Yeah, don't talk to them forensic psychologist. Forensic psychologist? Oh my God, I worked as a psychiatrist. With a psychiatrist? My meds. Right? Psychiatrists don't care about your meds. All right. Don't tell him you don't want to take your meds, right? And tell him about how the meds are working, and if it matches what the drug is you're on, you might pass, right? And if you say it's working well with you, and you're having a good day, and you don't get into too much talk like I do about the, seeing appearing in the, because I got pinched, and everything got pinch. Don't get, the biggest thing, they all say, don't get caught. Well, I got snitched on by everyone.